We have an outpatient alcohol and drug clinic where we treat substance use disorders, group therapy, individual therapy, family therapy.
Most of the people that we work with started off with some kind of chronic medical condition, and they were prescribed an opiate for pain.
We've recently hired a psychiatrist, and we also have a nurse practitioner who are able to prescribe medication that helps in opiate addiction. That's called Suboxone.
We started offering Suboxone in conjunction with our outpatient therapy as a way to enhance the service.
There was a real need for prescribers, and there was actually a shortage. People are driving hundreds of miles to access this type of treatment, and we were fortunate enough to have access to a full-time psychiatrist who's able to prescribe the medication.
Suboxone helps people from withdrawing from opiates. So if a person is starting to experience mild withdrawal symptoms they haven't used in a day or two, starting to feel like sweaty palms, not being able to sleep, having problems with their digestion, they take the Suboxone, and the Suboxone relieves those symptoms by giving them a little bit of an opiate just to take the edge off.
It's used in addiction treatment in a couple of ways. One way is that people who are addicted to drugs like heroin, often later in the addiction, they don't get high so much. They just don't want to be sick when they withdraw. And since Suboxone is a partial agonist, what it does is that it acts like heroin so people don't get sick. They can stop using heroin, take this medicine, which is prescribed by mouth. They don't get sick, and then they can move on with their lives and stop having to hustle for the next high.
People don't typically become drug addicts because they have great coping skills in life, or because they woke up one day and said, I'm going to shoot heroin today. So usually there's stuff going on that's underlying that makes a person more predisposed to wanting to alter their brain chemistry. So we talk with people once they're engaged and sober for a little while. We kind of talk about, what do you think led to you being an addict? And if it's not a person who was just started out on this pain prescription and then became addicted, and it progressed from there. If it's a person who did start out taking opiates on the street, or did start out taking other drugs on the street, we kind of talk about what was going on in your life at that time and try to pinpoint what happened and heal that part of their life so that they can move forward.
The medication part is really just dealing with the opiate, but the treatment component is going to address, all other areas of someone's life, whether it's grief and loss, trauma, mental health issues. There could be a slew of issues that people are dealing with, and we'll address all of those.
In my group, we have 6 admitted patients. They're all doing very well. They meet with me 3 days a week in group therapy. And in the beginning, they can meet with me as much as 1 time a week for individual therapy, and then we can taper off from there. Just offering people a lot of support and keeping them engaged. We only give people, in the beginning, a few days of their medication to make sure that they're going to come back, they're going to stay engaged, and that we can monitor them and make sure they're doing all right.
The one thing I will say is that people tend to be more successful if they're doing treatment in conjunction with Suboxone, and a lot of clients may want to come in and just try the Suboxone. So I would encourage people to think about, participating in treatment and doing the two together, if they're really interested in being successful.
One other thing I wanted to mention is that we do provide Narcan to the community. So Narcan is a medication that people can be trained to give someone that's in an active opiate overdose. So if anybody in the community is interested in being trained with Narcan, you can come here to our front desk, say, I want a Narcan kit. We'll have a staff member train them quickly, give them a certificate that says that they've been trained, and they can walk out the door with a Narcan kit. No questions asked, whether it's for them, a family member, or anything. We'll also give them information about treatment and that kind of stuff as well. But we do have it here, and if anybody needs it, anybody at all, they can come here and get it.